towards the implementation of primary health care under one roof in the states and the local government. IHP has supported different aspects, especially as it has to do with service delivery, service provision. Implementation is at the sub-national level. When I say sub-national, I mean the states and the local government areas all over the country. So for you to effectively implement primary health care, the first step starts with the establishment of the State Primary Health Care Board.
IHP, together with other partners, played a significant role in crystallizing the primary healthcare under one roof policy into the 9 implementation pillars. And we work to see, based on data that's available, to see what are the issues at the baseline at the various states. We identified together with other stakeholders led by NPHCDA to make sure that a framework was put that state governments have to be supported to make sure that those laws are kind of crafted and discussed with various stakeholders to make sure they give the necessary authority to, one, the formation of a semi-autonomous state primary healthcare board, which will be like the overarching governing structure at state that would kind of guide and support implementation of all service delivery actions at the state level and down to the local government.
The IHP have helped us to be able to put our staff together, train them on their roles in PHCs, law cadres. Currently, all the staff of the PHC are under the agency, no longer in the local governments as before. Promotion, conversion of the staff that had not been converted to the scale of health worker, that's COHES, is ongoing. Custody of IHP, you said. That's what we call integration in primary care under one roof. IHP did a lot in terms of training our staff, supervision of our activities in the PHC.
You also contributed in the tax shifting policy. So what tax shifting policy has done was that there are key things they identify, and people were trained. IHP contributed immensely, they mentioned it, to this tax shifting policy. And tax shifting policy saves lives, reduces maternal mortality. So IHP invariably contributed to reduction of maternal mortality through tax shifting policy, which to me is great.
First of all, a big thanks to IHP for helping us to improve in our health management. They have brought to us knowledge on how to manage maternal mortality and morbidity rates. They also help us to know how to render family planning services.
Beyond the review of an implementation of NHMIS, DHIS2, IHP also supported systems at the federal, the state, local government and facility levels to ensure data use, data analysis and data use. And this involved working with technical working groups to strengthen the system to ensure that data was being used appropriately for planning.
During this partnership, a great impact was made in the area of health financing. IHP supported the state towards strengthening the state contributory health insurance scheme. Through this partnership, the agency responsible for running the contributory health insurance scheme was supported to develop the guidelines and also standard operating procedures, which greatly improve the capacity of the agency to carry out its mandate.
You said IHP also facilitated the signing of Memorandum of Understanding between SOKEMA and the Nigerian Labour Congress, organized labor, including TUC and other affiliates, to see to the implementation of the formal sector program of SOKEMA. You said IHP also facilitated the mobilization of the informal sector, which we know is the virgin sector in the health insurance program. They facilitated the State Oversight Committee meeting, which is done quarterly to review the implementation of the Basic Healthcare Provision Fund, which we know is a program from the federal government to see to the enrollment and provision of services for the vulnerable part of the population.
An zo ƙauyen mu bakin kasuwa dafa, an ansa sunayen mu a mana rajista, kuma gashi ciki ya samu, na zo general asibiti ba an san kuɗi nawa ba, an min tiyata kuma an bani jini kyauta. Ina gode ma IHP, kuma ina gode ma yan asibiti. Allah ya ɗaukaka, Allah masa ɗaukaka, ya girmama su. Na gode.